Hi, my name is Alessandra Bice, and I will be doing the prenatal education for a healthy pregnancy video today. I'm going to start by performing hand hygiene, closing the door and shutting the curtain to provide privacy, introducing myself to the patient, and checking the patient's name and date of birth to verify our patient. We're going to start by discussing how often this patient is going to meet with her provider throughout her 40-week pregnancy. For the first 28 weeks, she'll meet with her provider once a month. From 28 weeks to 36 weeks, she will meet with the provider every 2 weeks. And then 36 weeks of delivery, she'll meet with the provider once a week. During these visits, we're going to check things like the mother's vitals, such as blood pressure, heart rate. We'll check her weight, development of the mother and the fetus, check the measurements of the baby, fundal height, and fetal heart rate. During the first visit, we're going to want to check the mother's blood type as well as her RH factor to see if she's going to need that Rogaine shot. We're going to monitor or check her for STDs, check her CBC or ACBC on the mother, and check for her immunity to chickenpox just to see if she needs to update her vaccines. During 26 to 28 weeks is when we will check for gestational diabetes, and then during 18 to 20 weeks is when we will check for the sex of that baby, and then 36 weeks, after 36 weeks, we can check for that group B strep. We then will want to move on to educating the mother on the proper diet she should have during pregnancy. We'll want her to increase her caloric intake just a little bit, but not too much to where she's gaining too much weight. Her healthy weight gain will be determined on her BMI. So if she's between 18 and 24.9% BMI, she will only need to gain about 6 to 12 pounds for a healthy weight gain. If she's under 18% BMI, meaning she's underweight, she'll obviously need to gain more weight. And if she's overweight, over 25% BMI, she'll need to gain less weight. And if she's considered obese, over 30% BMI, then she will definitely need to gain even less weight, anywhere from like 5 pounds to 9, I think. We also want to educate her on the proper diet. So that would be to intake less sugar because that could cause gestational diabetes, less saturated fats because that can also cause gestational diabetes, and then less salt because that can contribute to maternal hypertension. We would want to educate her on starting a supplement of prenatal vitamin that has calcium and iron because iron is especially important if the mother's been deemed anemic. And then we would also want to educate her to start a folic acid supplement to prevent neural tube defects. We then would want to educate her on the proper exercise. So we would want her to do low impact exercise. So things like running would not be okay because that's high impact. Jogging, things that are gonna jump and move and, jumping jacks, stuff like that. We would want her to do things like yoga. Maybe 30 minutes a day would be appropriate. Light exercises that are easy on the body, I guess is what I mean. We then want to discuss with her the common complaints that occur during pregnancy, one being nausea and vomiting. This can be relieved with eating a piece of toast or crackers first thing in the morning, and also like periodic light snacking during the day. Because sometimes being nauseous and throwing up can cause you to not want to eat, especially if everything makes you throw up. So light snacks are usually easier on the stomach. The second complaint that's often heard is fatigue or just an overwhelming feeling of tiredness all the time in the first trimester. This can be relieved with periodic rest periods throughout the day as well as in between activities, just to help get that extra rest. And then third would be constipation. This can be relieved with increased water intake or fluid intake and increase of fiber intake. And then we would want to move on to discussing 3 warning signs in which the mother should call the provider immediately. One can be bleeding. Any bleeding at all, especially before 20 weeks, is not normal. This can be due to a miscarriage or portus of the fetus that is not wanted. So you should call your provider immediately if you find any bleeding. Second would be the hyperemesis gravidarum. This is uncontrolled vomiting that occurs well into the 3rd trimester. This can lead to severe dehydration, poor nutritional intake, and overall just make the mother completely miserable. This can end up in hospitalization just because the mother may not be gaining enough weight or she's severely dehydrated. So that would be something you need to call your provider about or let them know about immediately. And then third would be, excuse me, placental abruption. This is characterized by increased pain in the abdomen and dark red colored bleeding that's heavy. This can be deadly to both the mother and the baby, and can occur due to hypertension of the mother or trauma or anything that's going to cause that placenta to detach. So that would be important to call your provider immediately. That will conclude my video today. Thank you.